Hi, good morning. My name is Ellie and I'll be your host for today. The COVID-19 pandemic has significantly impacted every aspect of our daily lives and is straining our healthcare system. It is especially disruptive for cancer patients and survivors who require ongoing medical care, including scans, labs, or follow-up visits. Today, we have with us here Dr. Hafizah Zaharah, consultant oncologist from Sunway Medical Center Velocity, and Dr. Lim Ren Jye, our director and TCM and Integrative Medicine consultant from Sunway TCM Center. They are here to give us some facts about cancer and also provide some answers and reassurance in this time of need. Without further ado, Dr. Hafizah, could you kickstart with a session with the current statistics of cancer globally or specifically in Malaysia?
Thank you, Ellie. So I think I should focus specifically for Malaysia because that is what is happening currently. The lifetime risk for Malaysians to develop cancer before the age of 75 is 1 in 10 for male and 1 in 9 for female. That means for every 10 male, 1 will develop cancer, and for every 9 female, 1 will develop cancer. Okay. So another important information that I want to share is for the 3 most common cancer among Malaysian, for the number 1 is breast cancer, number 2 is colorectal cancer, and number 3 is lung cancer. What is in fact worrying is majority developed or presented at stage 3 and 4. So why is this happening? Is because many among us still downplay the red flag symptom. For example, blood in the stool or breast lump, and then they decided to seek treatment at a later stage as they think it is not really important to seek help immediately, which is very wrong.
Okay, thank you, doctor. There have also been delays in urgent referrals and cancer treatment, such as chemotherapy postponed or surgery delayed. Should cancer treatment be postponed?
Decision on whether to postpone or not cancer treatment need to be made from patient to patient basis by the treating oncologist. So we know it is a challenge to manage cancer patients, especially during this pandemic, because first, if we delay the treatment, it can affect the overall survival or cancer control. However, we also need to weigh against the risk of patient exposure to COVID-19 infection. And there are also patients with potential medical emergency, for example, cancer patients that develop fever after chemotherapy, or patients suffering from severe pain, or patients with potential bleeding to the cancer. So these scenarios are considered medical emergency, hence they need attention immediately. Second issue is it's very difficult to postpone patient who is already ongoing intravenous chemotherapy and radiotherapy in a curative setting. So for example, for a patient with head and neck cancer, they usually require around 30 to 35 sessions of radiotherapy in 6 to 7 consecutive weeks. So for every week delay, there is in fact 14% loss in cancer control. So it's not very easy to postpone treatment for cancer patients, especially those who is treated for curative or radical intent. There's also one important point that I want to share is priority should also be given to patients who already completed the chemotherapy and has been planned for surgery. So further delay in surgery may result in poorer outcome for cancer patients. Of course, there are also subgroup of cancer patients that we can delay the clinic visit. For example, stable patient who is on tablet endocrine therapy, patient have the option to have or to get a few months more supply of the medication from the hospital, and the clinic visit can be postponed. In fact, some hospitals also provide postal service, and they can post the oral medication to the home of cancer patient. Telehealth video calls to replace clinic visit is also an option. Hence, patient can just log in and communicate with the treating doctor via telemedicine. So patient don't have to go to the hospital.
Thank you so much, Dr. Hafizah. Dr. Lim, knowing that Sunway TCM Center started operation since 2019, can you share with us your experiences in cancer management working with the oncologist?
I think worldwide, there are actually a lot of reputable institutions, for example, Mayo Clinics, Christie Hospitals, MD Anderson's, whereby the cancer center have been equipped with this integrative medicine department. And yes, in Malaysia, it's not an easy way to work with oncologists. Okay, but like what I usually share with my audience, ever since government started the TNCM or traditional and complementary medicine units in the government hospitals, that was about 13 years back. And initially we received a lot of resistance from the oncologists. And then slowly, with the approach we adopt, for example, using a research-based and evidence-based method, and with more and more convincing data, now we are gaining some popularity, and I get a lot of referrals from the oncologist colleagues as compared to before, whereby they are the first to stand up, and there are a lot of challenges we have to go through. But now, I think today we can sit together with Dr. Hafizah, and then she was actually my ex-colleagues in National Cancer Institute. We have been working closely and for the benefits of our patient.
Oh, that's wonderful, Doctor. So are there any other collaborations that TCM has worked with, any successful stories that you would like to share with us?
I think like what I just recently shared, we have conducted a number of studies in terms of efficacy of using the TCM and the safety profile of using TCM. So when you mention about TCM, there are mainly two branches. One is about acupuncture, the other part will be on the herbal treatment. So we have actually conducted a study for patients after radiotherapy, they end up with oral dryness. This group of patients actually having the radiotherapy over the head and neck cancer. So they suffer the oral dryness, and there's a minimal intervention actually we as a Western medical doctor can provide to the patient. Under these circumstances, actually what we have done is we offer the herbal treatment. And believe it or not, and we have actually published the articles early of last year, and it's a positive result. And ever since then, we have been using these articles and try to convince our colleagues that the herbal treatment can be done under a scientific method. At the same time, we want to convince them as well, and it's safe. So this is one of the examples. Another example will be on the acupuncture side, whereby when we use the acupuncture, like just recently I received 2 cases from Dr. Hafizah. One is for the chemo-induced nausea and vomiting.
Okay.
So it's a norm or routine for us in the National Cancer Institute, whereby we offer the acupuncture for those patients who is going to receive the chemotherapy. Before they receive the chemotherapy, they actually come and do the acupuncture at 4 points, 1, 2, 3, 4. And then after the acupuncture, the patients will continue with their chemotherapy. And that's, again, we found out there's a positive results whereby the intensity of the nausea and the vomiting within the first 24 hours is actually improved. And one more cases like referred from Dr. Hafizah is for the peripheral neuropathy. What is peripheral neuropathy? Patients after receiving the chemotherapy, they end up with a numbness or the tingling sensation or pain sensation over the hands and their foot. So again, we received the referral for acupuncture, and we found out that a lot of disreputable institutions that's been using the acupuncture to treat the peripheral neuropathy for long.
Oh, thank you, Dr. Lim. Dr. Hafizah, are cancer patients more vulnerable to contract COVID-19 virus? What are some protective measures that cancer patients should take?
So the answer is yes, correct. Cancer patients are more vulnerable to contract COVID-19 infection. So if I may refer to a recent research or study conducted in China, they reported that cancer patient who had COVID-19 infection, they underwent chemotherapy in the past month. So cancer patient who just underwent or completed chemotherapy is at higher risk to develop COVID-19 infection compared to cancer patient who has not had any recent cancer treatment. Okay? And the risk also appear to be higher if the patient has more than one chronic disease or medical condition, for example, heart disease, second, diabetes, or lung disease. So what are among the protective measure that can be taken? There is a patient who is on chemotherapy should receive supportive care to reduce the side effects. There is also an injection that can be given after chemotherapy to boost up the immune system, hence reduce the risk of infection. So it is called GCSF infection or granulocyte colony stimulating factor. So this can be given each time after the chemotherapy. Apart from wearing face masks and social distancing, I think proper hygiene is still one of the best defense against germs and bacteria. So hand washing frequently using water and soap for 20 seconds is still the best defense from infection. Okay. Second thing is be physically active. Walking around the house, using common household objects to replace weight can be done easily at home. And many cancer support websites also provide video for exercise suitable for cancer patient or cancer survivor patients. Okay. And third is special attention also need to be given to well-balanced diet, proper food intake that should include fibers, vitamins and minerals. There's also example of food such as eggs, lean meat like chicken or fish that can also provide protein. So these are a few points that need to be looked into, which is a well-balanced diet and food that also provide vitamins, fibers and minerals to cancer patients.
Thank you, Doctor.
I think I have something to add on.
Yes,
in terms of
Dr.
the exercise, and for advertisement. In fact, our Sunway TCM FB, there is a video clips by our TCM physicians by teaching for those patients or people who stay at home to practice some Tai Chi or what we call a 𝐌𝐞𝐞𝐿 exercise for the patient. So you can do it in a sitting position and that's able to improve the flexibility of your body. So thanks for advertisement.
Yes, that's wonderful.
Okay.
Okay, so doctor, if let's say we are interested in having this treatment or this courses, how do we inquire?
You mean the courses for the acupuncture or the herbal treatment?
The treatment.
The treatment.
Yes.
I think it really depends on what type of symptoms or the signs or the reason for referral from our oncologist. If it's only for symptomatic relief or reducing the side effects from the conventional treatments, then the medications or the acupuncture actually is a very short course, for example, maybe 3 months or 6 months. And that's if in long term, for example, some of the study which has been conducted in Korea, Hong Kong or China, they found out the patients who has been put on the herbal treatment after they have completed the radiotherapy and the adjunct treatment from the oncologist, and then having put on the herbal treatment, that seems to do better as compared to those without the herbal treatment.
Wow.
So they will be put on, for example, 3 years or 5 years, and basically that's the overall ideas of using the herbal treatment. I think at the end of the day, most of the important matters for a cancer patient is trying to reduce the rate of recurrence and relapse.
Yes.
So this is something that the TMCN side is also actively looking into. Besides the patients put under surveillance by our oncologist or our surgeon, at the same time, we have the TCM's herbal treatments to provide. For me, I always inform my patient as an insurance at least.
Yes, yes. Oh, thank you so much for the informative session, Doctor. So back to Dr. Hafizah, the COVID-19 pandemic has caused depression and anxiety to us all, as we all know. What can cancer patients and their family members do to find support and maintain emotional wellness?
So for for cancer patient, there is, in fact, they can reach out to many cancer support group. So there is you can inquire from the hospital or even close to the community what cancer support group available, and then the patient or patient caretaker can make a phone call or a video call to such cancer support group. They can in fact provide information regarding the self-care, nutrition, caregiving, and also, of course, provide emotional support. The second thing that I also want to share with patient is avoid information overload and taking a break from news and social media that is related to COVID-19, because sometimes it can be overwhelming. Okay, you should focus on how to enhance the mental and physical health by doing regular exercise, by talking and communicating with the family members either via video call or phone call. In fact, you can also engage your friends, a colleague regularly, like once a day or once a week, in terms of how to share information and to provide support for each other. There's also, of course, professional support such as counselor and psychiatrist, just a phone call away, because some hospitals also provide telemedicine services for such patients.
Thank you so much, Dr. Hafizah. So Dr. Lim, back to you. How can I boost my immune system? Can TCM help us to keep us strong?
I think these are some of the myths, or what we call some information has been spreading around the community, saying that taking this vitamin C, some variables, herbs, in order to boost up the immune system. I think at the end of the day, especially during the COVID pandemic, the important things will be on the hand washing and then social distancing.
Okay.
At the same time, wear your mask and try to reduce your chance of being transmitted to the crowded area. I think these are the few very important points from being transmitted with the COVID-19. But yes, in the TCM world, there are actually some formulas which has been practiced for years and for centuries to improve their overall general well-being. For example, one of the things whereby we have been used frequently will be on the 𝐿 side. This is a traditional formula, and the Koreans and the Hong Kong have been conducted studies on using this to prevent a common flu and allergic rhinitis. And it seems encouraging, but whether this will be useful for COVID cases, I think they're still yet to prove it. And again, we have the guideline. Recently, we have just a meeting with the China expert team, and they have shown us and published the 7 editions of the China COVID-19 clinical guideline. And yes, according to the data that shown us, it seems quite promising. At the same time, we have to reconsider on the applications or implementations in Malaysia community. Because in TCM, we believe in one thing, whereby the environment and the community or the population here is a little bit different from in China. So we might need to cater the personalized treatment for the patients in Malaysia. As compared, we cannot just duplicate the same guideline in Malaysia itself.
Yes.
So these are some concepts which is different from the Western medicine, whereby, for example, remdesivir, we want to conduct it. It's one medication for worldwide. But TCM is something that very personalized to the patient. So we need to adapt and adopt wisely.
Yes, yes, Doctor. Thank you so much, Dr. Hafizah and Dr. Lim, for the insightful sharing about cancer and tips on how cancer patients can cope during this difficult time. So let us now check on our comment section to see if there are any inquiries for our doctors. We have one. Doctors, can garlic or onion help to kill virus? What about hot water?
Well, so happen that we have this, you're asking this, right? Is it? Surprisingly, coincidentally, we have this, okay? Good. We prepared in hands, and then surprisingly, there's someone asking in the comment as well. Good. So
Yes,
today, Hafizah,
yes.
you want to answer this? I think these are very popular questions, right?
Yes, yes. Yeah, I get occasionally my patient asking, can this taking garlic, onion, drinking hot water keep the virus, kill the virus? Can we just go outside, expose ourselves to sunlight and kill the coronavirus also? So the answer is no. There is no evidence that such food or exposure to the sunlight can kill the coronavirus. So there is no easy way. You still need to do the proper hand washing, social distancing, and wear face masks and avoid crowded places in order for us to go through this pandemic together and win against this battle.
I think I have something to add on in terms of the sunlight. That's we know different rays in the sunlight. So it's UVA, UVB,
Yes.
and UVC.
Yes.
A for aging, B for burn, tan, and the C is the one has the power, I call it the capacity to kill the virus or alter the genetics contents of the virus. And in China itself, actually they have been using this UVC to do some form of sterilizations for their public transport. For example, bus.
Yes,
But
yes.
in Malaysia itself, I doubt we are using this. At the same time, by going out there and having the sunshine or sun bath, it's not going to kill any COVID-19 for you, because our ozone itself has actually filtered out all the UVC out there. So what you receive when you stand on your beach itself, then you will only receive the UVA and UVB. Okay?
Okay, thank you, doctor.
Any other, if you have no more questions, I think we have some questions in hand before, and then there are some myths, in fact.
Yes, yes. I think we would like to know about those as well.
Oh yeah, this is one of the very favorite questions. Actually, I've been asked by my patients many times. This is about whether you will contract the virus, the COVID-19 virus, by receiving packages.
Yes.
And this is not only applicable on the package itself, it's also applied on the delivery. Because when our center offering the teleconsultation and the herbal delivery to the patients, what the patients they are concerned the most is not whether your parcel delivered on time, but they're worried whether the person who sent the parcels, will there be any chance of transmitting the COVID-19? I think, and including the parcel from China. I think, meantime, there are no data, because you think along the line, from the center who send out the parcel, you have to go through so many different hands, and then some by air, some by ship, some by some special form of delivery way here. So by the time it reach you, it's very hard for you to get any form of virus by just receiving the parcel itself. But to play a safe side, I would suggest that maybe you can have some sterilizer or some form of alcohol spray, and in order to disinfect it, so to make yourself feel comfortable. But for me personally, there's no data to show that anyone actually being transmitted or get infected with the COVID-19 by receiving a parcel. Okay.
Yes, thank you, doctor. We have one from our comments which states that which side effects of chemotherapy or radiotherapy that TCM is able to help reduce?
There are quite a number, but one of it that we usually use will be on the improving appetite and improving the insomnia. Insomnia means sleeping disorder. I think Dr. Hafizah will be very familiar with this because a lot of patients actually they themselves is not because of the chemotherapy they cannot sleep, but because of the cancer disease itself. They feel very anxious, and then they are sometimes worried about how the disease progress, especially the night before they receive their CT imaging or the PET scan.
Yeah.
It's like going through another SPM or STPM or your university's medical course again. So the patients having been suffered emotionally stressed for long. So some of them they end up in our center, and we try to improve using the herbal treatment and to improve their sleeping. At the same time, there are patients who has been referred to our oncologist here because of pancytopenia, or what you call you do not have enough white cell count, you do not have hemoglobins, and you do not have enough platelets, which are the three main indicators that our oncologist will walk through before the patient is going through chemotherapy. So sometimes we will intervene, but bear in mind, our cooperation with oncologists is perfect in the sense that we don't interrupt with our oncologist in chemotherapy infusion. Meaning, when the patient's having the chemotherapy, we are not going to touch the patient. Only intervally, when there's a gap, 1 week or 2, for example, a 3-weekly regime, the patient will receive on the day 1 and day 21. So in between there's a gap, then we give it to the patient. So this is trying to minimize what the oncologist or ourselves worry the most on the drug-herb interaction, which is very important because we want to maximize the therapeutic or curative effect from the chemotherapy. At the same time, we want to improve the patient's overall well-being. So we have to take the balance. In that sense, the approach we are adopting in our center is actually different. Maybe different. I don't know how the others actually practice out there. But at least in the National Cancer Institute and Sunway TCM Center, the way we do it is like this.
Okay, thank you, doctor. We have another question. It states, what is the approach of TCM in treating cancer? Is it to replenish the shui and qi?
Oh, surprisingly, someone asking about qi and what else?
Shui.
Oh, blood.
Yeah, blood.
Blood
Yeah,
and
blood.
qi.
Shui
Blood
and
and
qi.
qi. You have any ideas, Hafizah? What's blood and qi?
I know blood.
You know blood?
I know
Good.
blood. Okay.
But
I know qi.
well, you know qi as well?
Yes.
It's not the Samsung qi recharge, right?
No. I mean, I think it's about the well-being. Okay.
Yes.
So in terms of of course, from my side, we will provide medication and also some injection to boost up either the blood count and also to boost up the patient nutritional status, because nutrition is still the main key point for patient in order to go through the long process of treatment successfully. Okay?
I can't agree more. Because meantime, if I always discuss with our patients, the herbal treatment we are giving is just like a form of grease oil. Okay. The engine want to run, what does it need the most? You need the petrol. And at the same time, what's the most direct way in order to boost up your hemoglobin or your white cell count platelet in your body? It's either by blood transfusion or the GCSF
injection
by our oncologist, just of filgrastim for the platelet. One of the injection itself is actually able to boost up.
Yes.
But you have to remember, what we have done is actually we are withdrawing or pushing those reservoir in the bone marrow itself coming out. At the same time, nutrition-wise is the most important thing. And what's the role of the herbal treatment here is we promote the whole process. We increase the whole process itself. By doing this itself, and then we are supporting at the back, then the oncologist will be the hero. But we are the supportive ground staff to make sure they can fly. Of course, nowadays we cannot fly because of the COVID problems. But I believe one day they still need the ground staff in order to fly, right?
Yes,
Okay.
yes.
Yep.
Okay, thank you so much, doctors. So one last question. I've got a friend who recently just asked me that he read an article that vaccine of COVID-19 may not be found. No one can guarantee that at the moment. And so as well as for dengue fever and AIDS, they have no vaccines as well. So in such situation, life is at threat, don't you think so? And what can us humans do to protect ourselves and our loved ones, aside from washing our hands, having sanitizing our environment, and also wearing masks?
Okay, I think that is a
very
difficult
broad question.
Yes.
and also difficult question on vaccine, because even as we speak, at this moment, we do not really know if or when the vaccine against COVID-19 will be available. Okay, and then I think also another point of discussion is herd immunity.
Yep.
People are talking, if let's say we just continue with our daily living, get exposed to the COVID-19 infection and subsequently develop herd immunity. So also the answer is, at this moment there's no evidence for that. And then what is the problem is in terms of the concept of herd immunity. In order to achieve that, there will be a risk of some percentage of mortality, patient who succumb, high risk patient who succumb to the infection itself. So until we get more information or more evidence about herd immunity or the availability of vaccine, there is no choice but to adhere to the current WHO guideline or the Ministry of Health guideline in terms of hand washing, social distancing, and face mask wearing. And this, we just have to accept this will be the new norm. For how long? That is also $1 million question.
Yeah. I think maybe I just add on some points.
Yes, Dr. Lim.
One of the concerns about the vaccinations we have in mind is we found out that the virus, there are many different strains. Initially, there are only 3 strains. And recently, there was articles talking about there are 30 strains.
Yeah, it's the evolution, yes.
So I doubt whether the vaccines that we tackle initially on the few major strains will be able to provide. There's something to be always wonder. And yes, we can only pray for the best. But like what been suggested and have been keep on promoting is the social distancing and the wearing masks and hand washing. These are the 3 simple things of keeping a good personal hygiene to avoid to get this COVID-19. And our country has put in so many efforts and losing so many money in terms of trying to contain the virus. So I hope everyone can practice this and end of the day will win the war.
Yeah, I think everybody play a part. We need to cooperate about this. We know that most probably there will be no Hari Raya celebration, but it's okay as long as we know that our family members is safe. There will be always Raya celebration the following year or after. Okay, what is important is we need to keep everybody safe, especially those who are at higher risk.
Dan baru ada peluang untuk celebrate Hari Raya. Kan?
Thank you, doctors. Apparently, we have 2 more questions. So what are the advice that you would give for the caretakers of cancer patients in the midst of COVID-19? So just now we talked about cancer patients, and now we have question asking what about the caregivers?
These are the questions that I suppose the infectious disease consultant have to provide their opinions. Maybe Hafizah?
Yes.
Yeah.
So we know that among the stress that faced by the cancer or caregiver is lack of lack of rest. Okay, and then furthermore, in the current situation, they have no choice and just have to be confined in the one house, and they are not able to go out or to visit other friends or even go to the window shopping outside. So I think in terms of the caregiver, the most important thing would be still maintaining communication with your family members, with your colleague, with your friends, either via phone call or video call, and as well as the cancer support group. We have this facility available either in the community or in the hospital setting. Use this, reach out to this group of people to provide you advice Okay, and also don't forget that there's professional help, like the psychologist, counselor, and even psychiatrists that can provide help in terms of this very difficult situation.
Okay, so I think this question we have is for Dr. Lim and also for
I thought
Dr.
your last
Hafizah.
questions, really last questions.
No,
There's one more question.
we have more questions
Okay,
coming in, yes. So are there any herbs or supplements
Right.
that can help in boosting our immune system?
I think it's the same question like what we discussed before.
So it's
There
the
are
herbal.
formulas, there are single herbs, whereby there are a lot of preclinical data to show it may improve in terms of white cell counts or in some cytokines, whereby indirectly you will consider that as boosting up your immune system. But bear in mind, most of the herbs we having is preclinical data. That means on the human being itself, we still need a lot of data to support this usage. And what bothers the TCM physicians the most of the time is in terms of the study methodology. Because the way we have been using herbs is very specialized or personalized to our patient need. And this is something whereby our conventional research methodology is difficult to evaluate its efficacy. So it's a challenging time where more and more researchers have to look into it. And then maybe one day later, we will do something like, oh, I have this herbs itself, and they're able to boost your immune system by elevating the white cell count one day. But meantime, we still need more data. Otherwise, in the daily life, your diet itself, make sure you have balanced diets or some healthy lifestyle, practice your qigong or regular exercise, even at home. I think that's also a good way to build up your defense system.
Okay, thank you for sharing, Doctor. So one last question.
Your last ever ending.
How about integrative medicine treatment using both Western medicine and Chinese medicine? Can doctors share their success story?
Sorry, pardon?
So we have this question asking about integrative medicine treatment using both Western and Chinese medicine. So are there any success cases at the moment?
I think the published articles itself is already once a solid on both sides of data to tell you whether the way that we adopt, whether it's actually successful or not. And then our study actually conducted in National Cancer Institute in 2017 till 2019. And I believe there are more and more data is coming out. Yes, we still have to admit that there's a lot of compounding factors when we design the study for using the TCM. At the same time, I believe with more data to support its usage, actually we found out that more and more oncologists has been referring patients to the TCM physicians, and then we are actually working closely now, and then we notify each other if we found out there's any problem. For example, I just discussed with Dr. Hafizah last night. There was a patient suddenly pop up, and then we found out it's not a suitable candidate. Actually, we should approach using the TCM method first. It's better for us to refer to a surgeon and an oncologist, and then after they have provided some things and able to do a curative approach, then later TCM or the acupuncture or herbal treatment can go in later. I think we have to really come up with one of more cooperative way, and in order to achieve the best benefit for our patients as compared to last time, whereby the TCM physician can never work together with our oncologists. But nowadays, I believe the new generations have more data and to convince our counterpart, and that's how we get. Agree?
Yeah. All right. Thank you so much, doctors. So that is all we have for our Facebook Live today.
Thank you.
So yeah, if we have any further questions, they can dial into our teleconsultations to look for us, and then I'm sure doctors, you're happy to attend to them.
Sure.
Yes. So thank you for joining us.
We can show our telephone number here.
Unfortunately, no.
Okay.
Yes, but they can go into our website and make their appointments over there. So thank you for joining us. Remember to stay safe and stay home.
Thank you.
Thank you.